Hello, good evening, everyone, on this hot July night. I am Dr. Celia Egan. I am the internal medicine doctor and the director of obesity medicine at True Women's Health. And even though I do a lot with women's health and with obesity medicine, one of my real passions is helping women who have lipedema. And I feel so lucky tonight to have a special guest, Sarah Suydam, who is here from West Michigan Women, who is going to share her story, her health journey with lipedema. And this is meant to be an interactive conversation. So as we hear Sarah's story and we talk about different aspects of lipedema, please feel free to, send comments, questions, and we really hope that this is a good conversation. Sarah, thank you so much for coming on our True Women's Health Facebook Live.
Thank you so much for having me, Dr. Egan. I'm so excited to be here and to talk about my journey a little bit and to hopefully share some information that is really helpful to some other women who may be experiencing something similar to what I've experienced as well.
Yeah, I think that it's really exciting because even in the 10 years that I've been in the obesity medicine space, I would say the knowledge about lipedema and fat disorders and the differences between why women are gaining weight with lipedema versus just obesity. I think that knowledge, both with patients and doctors and providers, has really changed. And we always love to hear feedback from our patients of when they first heard about lipedema. Was it recently? Was it a long time ago? We always love to hear those sort of comments. So anyone who wants to put those comments in about just where they've heard about lipedema, when and how, we always love to hear that as we sort of listen to Sarah's story. So Sarah, again, thank you so much for sharing your story. I know it can sometimes be hard just to get it out there for everyone. And, thank you again. We feel so lucky that you're here. So how did your journey with lipedema start?
Sure. It truly began because of social media. The power of the algorithm sort of placed a couple videos in front of me that really resonated with me. One of them being a girl somewhat in my age range, looked like she was maybe mid-20s to mid-30s, really athletic. And she had posted a video showing her own body and saying, do you work out? Are you athletic? Do you do all these things?
Mm-hmm.
And yet, does your body resemble mine? And there were so many things about what I was seeing visually with her that ticked all those boxes in my brain. And I'm sitting there going, yes, wow, you look like twins almost. And she goes, well, I have lipedema. Maybe you do too. And I had no idea what that was. So then I was sort of like, okay, wait. And I fell down the rabbit hole, started just looking into doing research about what lipedema actually was. Because I truly had never seen or encountered many people ever who had similar legs to mine. Growing up, and it's one of those things where you're aware that they're different and you don't necessarily know why.
Yeah.
And you're told that, it's genetics or things like that. So that was the first time that it really, the light bulb went off for me that I thought, oh, this is something that I should be looking more into.
Yeah. And I'm just going to pause to highlight some of the things about your story, if you don't mind.
Go ahead.
Lipedema is what we call an adiposity disorder. So you have to think about those fat cells, which we all have, and which we all need, right, are not responding to hormones in a normal fashion. And when they get that hit of estrogen, they really multiply and expand very fast to the point where they almost outpace their blood supply. And it creates this entire inflammatory process that can lead to a lot of fibrosis being laid down, which can result in these painful nodules and swelling. And it just sort of snowballs out of control. The first time that a lot of women will experience that rapid onset of, fat expansion is in puberty, because that's when a woman gets these huge estrogen surges. So as someone who's taking care of many women with lipedema, I'll hear all the time, I was a normal kid until 10, 12, 15. And all of a sudden I was like a student athlete and I did all these things. And I was so I could not, understand what was happening. And it usually starts mostly at, women will describe their thighs, calves, and buttocks, hips region.
Mm-hmm. Yes, that is definitely that is definitely accurate for my experience as well at puberty. Knowing what I know now and looking back, I go, "Oh, yeah, puberty is when it all started for me."
Yeah. And Michelle said, I had never heard of it until I searched, why do I hurt so much at fatty spots?
Mhm,
Yes, Michelle, I thank you so much for sharing. One of the things with that rapid expansion of those fat cells and all that laying down of fibrotic tissue, you activate those nerves and your whole immune system, and it's very painful. And I think, one thing that is frustrating for women with lipedema is not only are you have this extra weight and it impedes your function, but it hurts like stink, right? I don't know if you have that experience, Sarah.
yes, that was one of those things that, in our conversation, I hadn't realized that I had normalized quite a lot of these symptoms and pain.
Yeah.
Um, there's a lot of things like the bruising very easily, um, the feelings of heaviness in my legs, like all of these things, or like even kneeling on the ground, like it felt like the fat on my legs. It almost felt like my legs wanted to burst because of how the pain when I'm kneeling down. Those types of things, I just sort of chalked it up to being like, "Oh, this is just how my body is. This is
Mhm.
people must experience something similar," not
Mhm.
knowing this whole time that, "Hey, this isn't normal. These are symptoms of this condition."
Mhm.
And, in our conversation, being able to finally, um, sort of name those things and having them have a place, or I should say, like, a box to fit into that made
Mhm.
it all make sense in my brain was really, really enlightening.
Mhm. And I think that just, I think normalizing
Mhm.
100%, I hear a lot from patients. And, I hear a lot of patients will be like, I thought that like I just hated massages, right? I just was like, massages aren't for me. Like the people giving me massages are just too rough or, and I just don't like to be touched. And I think the hardest thing is when people will say, I can't play with my kids. Like if my toddler sits on my lap, it really hurts terribly. And that really gets into people's heads a lot, women's heads about kind of like why they're doing certain things. In particular, when we talk to women about how lipedema may impact their life, it can be a minute for them to take a step back to say, gosh, I really have done so much on a day-to-day basis to change my activities from work and my social life because of sort of this extra weight or pain or swelling.
Mhm. Absolutely.
Yeah. And I think Diana May is adding some information, which I think is totally spot on. So she was sort of commenting that she was diagnosed with lipedema, but it got to the point that it has caused progressive lymphedema, which we're going to come back to and kind of talk a little bit about the differences between lipedema and lymphedema. But she also comments, and she's spot on, Diana, that there are a lot of comorbidities that can come with lipedema, including Ehlers-Danlos syndrome, mast cell activation syndrome, which is the MCAS, POTS, the secondary lymphedema, which we can talk about. Lipedema is a subcutaneous disorder or a disorder of your connective tissue. Your connective tissue is under your skin, but not including your bones and muscles. So you can think about it as all those different things that are connecting all of our basically parts together. And that includes our fascia, which that stretching out can lead to Ehlers-Danlos. It can include some of our blood vessels. That leads to POTS, which is basically your blood pressure swings wildly, and a lot of these different comorbidities that we see. There is another one too, which is actually there's research that shows that ADHD is actually linked with lipedema, which is very interesting. And there's some recommendations to use ADHD medications such as Adderall to help out with some of the swelling, which is kind of an interesting thought. I can't say that I've seen a ton of that being impactful, but there's some basic research from that. And I think it's always worth a try. Sarah, tell me a little bit more about kind of your journey of how you felt, once this clicked, kind of tell me more of what you were feeling.
Yeah, it was one just very validating to learn that, hey, this is potentially a reason for all of these things that I've experienced for most of my life. that I could never really find an answer for. This was something that truly um, felt in my bones. I knew I was like, oh, this explains so much. Um, so then I went into looking more about, okay, how is this diagnosed? Where can I get diagnosed? And that's when I came to learn that it's actually quite difficult for a lot of women to get diagnosed with lipedema, unfortunately. Um, so I was very fortunate that just through my work, being managing editor of West Michigan Woman, that I was familiar with True Women's Health, having written about some wellness topics in the past. And I was thrilled to learn that you are in our own backyard in Grand Rapids, and that
Right.
you are a specialist. That is something that I feel very lucky to have access to. So that's when I was like, all right, I'm going to book in an appointment. We're going to talk about this, and I'm going to see for sure if I'm getting it diagnosed. So, getting to have that appointment with you and going through talking about what exactly it takes to diagnose lipedema, that was super fascinating.
Yeah. And I will say, I think it's, I've spoken at like the Obesity Medical Association a couple years now, and our last talk was in front of 1,000 different doctors, right? Educating them about what lipedema is, the backbone of treatment plans, that we hope more doctors out there across the country can be available to provide a diagnosis for women in a treatment plan, which I think is awesome. So thank you. It was fate that we were sort of together. And I sort of got involved with lipedema because I just felt like this group of women that had no place to go.
Mhm.
And they were trying so hard. I would just, I'd have my patients come in and they would have like, just stacks of like exercise logs and nutritional logs and the receipts from seeing your nutritionist and their personal trainers. And they're like, see, like it's not working. And I'm like, oh my gosh, like you poor thing, you've been just like on this journey and it hasn't been working. And that just must feel so frustrating to not have a plan. And I think there's a lot of lipedema research that needs to be done, but something that's very clear, more exercise and more calorie restriction does not work. That is not going to be part of your plan. Right. And I think women just even sitting with that, knowing that you can't try a little bit harder. Like it's not like one more hour of exercise or one more night of being hungry that's going to make all these symptoms feel better and make all this extra fat go away. And so I hope some women can find some comfort in that. Now, there are things that you can do, definitely, right? And we can talk a little bit more about what those mean, but it's not just this like intense exercising regimen and calorie restriction where you're like starving yourself and not providing your body with nutrients that's going to get you sort of over the edge, which is just the common mantra that most doctors sort of lay out when they're talking to women about losing weight.
Yeah. Yeah. That's, I have some pretty personal experience with that without even obviously knowing I had lipedema. I used to be, I used to compete in the Miss America organization about, 10, 12, 15 years ago when I was in my early 20s. And that was one of those things where I was working with a trainer. I was eating, clean. I was eating right. And I was working out. We were doing like 2-a-day workouts. And while I was, lean in my torso and things, regardless of doing all of those things, regardless of being a competitive athlete growing up, my legs were always what they were because of my lipedema, and I didn't know it at the time. So it's just like really driving home that point that like no matter it's not worth it to put yourself through something really restrictive or really intense if that's what you're after, because unfortunately this is something that requires a little more targeted, intentional steps in it, and it's self-care is a really huge part of that.
It really is. And what we don't want to have happen is women chasing sort of this unreachable goal, right? Of sort of moving further and further.
Yes.
So we talked, when I see a woman with lipedema, I sort of group them into a couple different buckets. And when we're talking about symptoms, one is having extra fat tissue and that affecting their mobility and function. 2 is having pain to touch, pain to movement, that heaviness feeling. And then 3 is swelling. So as your fat cells expand and as your immune system comes in and lays fibrosis down, that space that's supposed to move fluid up and down your legs and up and down your arms becomes blocked off. And all that fluid tends to pool. The further away from your core of your body, the more pooling will happen. So we see pooling at the feet and calves, and sometimes all the way up to the thighs or sort of at the arms, sometimes even the midsection. And that also can be equally debilitating and frustrating because, women will say, gosh, my legs are so heavy. And the word I hear all the time is cement. They just feel like cement.
Mm-hmm.
And that really prevents them from kind of doing all the things that they need to do. Has swelling been a big, factor in your journey?
Yeah, it has. And it's also one of those things that I don't think I realized. I didn't think I realized I was swelling as much as I was once
Yeah.
I was so much more aware of it. And then I see, like, I was just on vacation in a tropical climate, and I could tell when I was there. And obviously, as you do on vacation, sometimes you're not necessarily eating or drinking in your normal routine. I noticed how my body was responding to not only heat, but maybe some inflammatory things that I was eating or drinking. And I could just tell down my legs that they just felt swollen. Flying on planes,
Mhm.
sitting for a long period of time, like all of
Yeah.
those things um, can certainly have an effect on the swelling or just even
Mhm.
the feeling of just needing to stand up and get your blood flowing.
Yeah.
Mhm.
And I think that really just impacts, again, it's one of those things that you sort of normalize when you have to do all the time. Yeah.
Absolutely.
I think we've done a good job of verbally talking about it. We're going to throw some pictures up to just throw some definitions out there for, I know there's a lot of women here who are commenting that they know they have lipedema and may have a lot of knowledge about type and stage, but we're just going to throw some pictures up just to talk a little bit more about, in terms of a diagnosis of what lipedema looks like. So lipedema is a clinical diagnosis. There is not one blood test. There is not one imaging study that can be done to say, yes, you have lipedema or you do not. If you have a diagnosis of lipedema from a provider who is able to ask the right questions and perform the right exam, you also should be given a type and a stage. A stage is how far, we'll start with the type. A type is, we're flipping back and forth. Okay, stage. We'll stick with stage. Stage is how far the fibrosis and adiposity tissue has progressed. So stage 1 obviously is very small amounts of adipose tissue and some fibrosis all the way up to stage 4. At stage 4, we're really talking about the lymphatic system being really blocked off and that woman experiencing pretty substantial swelling. Now, I always have to comment because if you look at a woman with stage 1, that looks like a lot of women's legs, right? There's not a lot of, abnormalities from a day-to-day, average woman that's what her legs look like. And so a lot of the times women with early stages may have to rely on other clinical symptoms, not just, that major rapid, adipose tissue expansion to help with a diagnosis. So
Mhm.
not only do you get a stage, we also talk about a type. A type is where is that extra fat tissue located or those disease fat cells located. So the types range from 1 to 5. So 1 is just at the hips. 2 is at the hips all the way down to the knees. 3 is all the way down to the ankles. So this is mostly including the calves. 4 is at the arms and 5 is at the calves only. I would say 5 is probably the most rare, and I have not seen very many type 5 women with type 5. You can be a type 4 and a type 3. So I would say the most common presentation I see is a type 3 and a type 4.
Mhm.
The story that I hear is that women a lot of the times will be a type 2 or a type 3, and then they'll either have a pregnancy or enter into perimenopause, and then they start noticing extra tissue at their arms, and sort of that tissue has expanded into a type 4. I will say there's, even within the research community, there's a lot of debate about whether or not you can have extra adipose tissue outside your extremities. So I know the researchers in the United States are sort of duking this out a bit with the researchers in Europe about, can you have extra adipose or disease adipose tissue at your trunk? So never really so much at your chest, but we're talking about like the upper abdomen, lower abdomen area. And I would agree that I've seen a good deal of lipedema tissue there. I've also heard cases of lipedema tissue even at your vulva, which is basically like your genitals, which you can imagine would be very painful, and something that we hope to explore more of and get those women some treatment options, because that sounds like it needs to be treated sort of immediately and would be really frustrating.
Yeah.
So if you're given, like I said, you should have a type and a stage. And from there, we can sort of talk about sort of different treatment options. Sarah, just out of curiosity, how did it feel once you, like, we finished our appointment and you were like, okay, now I know?
Yeah. I definitely had a little cry on the walk from the building to my car.
Cut out.
Oh, can you hear me? Are you there?
Oh,
Are you there?
we're having technical difficulties.
Okay.
Well,
am I here?
oh, there we go. You're back on. Yes.
Okay. Yay. Okay. I definitely had a little cry in between leaving the office to my car, just because it was very, it all became very real at that moment, because I truly knew, having self-diagnosed myself before coming to see you, that I was like, okay, prepare yourself, because I was pretty sure I had this.
Mm-hmm.
Prepare yourself to be told that you do. Be prepared to tell yourself that you don't. And you said, yes, absolutely. It was just such a validating experience. Getting a diagnosis just sort of really proves that, like, hey, I wasn't crazy.
Yeah.
All of these things, they are real, and they are really happening to me. And when a lot of women can be very, very often either misdiagnosed or dismissed by their providers sometimes, like, that is such a wonderful feeling to be believed and understood.
Yeah. And I know, Krista Lynn made a comment that this journey can be so lonely. And I agree with that, right? Because again, you're trying to play by all the rules that you know, and you're not winning the game. And it's like, what am I doing wrong? And it can feel so frustrating. Sarah, part of your journey was reduction surgery. And we're going to talk a little bit about what that means. But before we do that, let's just talk a little bit, because there may be some women out there who are still trying to figure this out for themselves. So we're just going to review the differences between lipedema, obesity, and lymphedema. So just so you know, you can be a woman who has lipedema and lymphedema, and you can be someone that just has lymphedema for a variety of different reasons. Okay. So lipedema, what makes it really distinct and unique is the vast majority, 99% of the time, this is in women. And it's pretty prevalent. About the research is anywhere from 11 to 20%. There's always bilateral symmetric tissue expansion or fat expansion. And when we see sort of this swelling, it's what we call non-pitting. So pitting is where basically you can push your thumb into your calf and it creates a pit or a little indentation that's there. Pitting edema is very much consistent with lymphedema. And typically lymphedema, although it can be at both legs, it can just be at one leg. When we touch the sort of the tissue of lipedema, women with lipedema, I will say it feels rather soft, albeit different than regular fat. Regular fat has a very like pillowy, much softer feeling to it in comparison to lipedema fat. And lipedema fat will have like you can feel almost like a granular tissue or nodules. The nodules can be anywhere from rice size to pea size to a garbanzo bean to a grape to even possibly bigger. And they will be in anywhere within the lipedema tissue. So it could be in your arms, in your thighs, at your calves. A lot of women will have like what we call knee overhang or knee pads, which is there's just this extra extra area of tissue that's kind of like hanging over the knee or over your elbow. And a lot of times that will have nodules. Of course, as we said, this feels very tender, which is very different than fat that comes from obesity. Rarely is that fat tender. And a big difference is even though women have swelling at their lower extremities in later stages of lipedema, it rarely gets infected, which is a very common problem for women with lip edema. Again, a big difference between lipedema and obesity that I think is really characteristic is, when patients come in to see obesity, they will also have more of a rounded tummy, which can be consistent with visceral fat, which is fat in and around our organs. And women with lipedema, a lot of the times will have almost no adipose tissue at their trunk and their upper abdomen, and all their adipose tissues can be located at their lower extremities. Now, you, of course, can have obesity and lipedema. That is 100% possible. And we would treat those sort of separately. Some of the treatment options may overlap, but for sure that those are two separate things that we're going to be thinking about in terms of treatment. Okay. What we're going to talk about next are some treatment options. So, Sarah, when you first learned about lipedema, where did you go to find some treatment options? Obviously we talked about a few things, but kind of where were you? Where was your next thought?
Yeah, I mean, I definitely wanted to get an expert perspective, which I was, very fortunate to get from you on conservative treatments and things to be done, things that you could implement in your life right away on a regular basis that can help. But I started looking to the internet because I wanted to connect with women who had been diagnosed and knew they were living with this condition, and just to get just for, emotional support, just to connect with people, but then also say like, what have you had success with? What if it sounds silly, but it's like, you kind of want to learn like the tricks of the trade, right?
Absolutely. Yeah.
So I really, honestly, Instagram was a really big place that I started, and was able to find a lot of people just to get those conversations started, about, hey, what has worked for you? And then knowing my own body, just sort of going from there and feeling out what I thought was realistic for me to begin to implement.
Yeah. I think even as a provider, one of the hard things that has been in this space is that there aren't clear clinical pathways. There aren't great medication recommendations. There's a good deal of at-home techniques and implementations that can be done that are just not calorie restriction and more exercise. And so, because we had this unmatched need, one of the things that we wanted to do at True Women's Health was launch a Lipedema Support Community. So the goal of this support community is to provide a place for women to go to just review their treatment options. It's broken down into those 3 different buckets that I talked about. And what we did is we sort of told 3 different women's stories based on kind of what I've seen in terms of clinical patterns. And then we had all the lipedema treatment options that are available. we are going to talk about surgery because I do think surgery is always an option for anyone with lipedema to just talk about. But in talking more about conservative care, what I would do if you're a woman who either knows that they have lipedema or is on the fence, and thinking about lipedema, the first thing you want to think of is, how am I going to tackle sort of this extra adipose tissue? So in our clinical vignette, that is one of our patients who is here, and I think her name is Mary. Oh, this is Sandy. So Mary has this extra adipose tissue, and this is really changing her function. And she's not able to move around as fast and as quick as she would like to. And when we talk about what she can do in terms of reducing this adipose tissue, there are a few things. I think very interestingly, there's been some good data about the, obesity medicines in that class, the GLP-1s. I'm extremely familiar with all the anti-obesity medications. And I would say that this class, much more than ever seen before, has been helpful at reducing both inflammation, pain, swelling, and extra adipose tissue for some of these women. Now, it will not reduce the fibrosis. So if you have had extra tissue that has been there and you have scarring the nodules, it's not going to take that away. That's something that's there to stay in terms of a medication management, but it is possible to reduce some of the extra adipose tissue. There are some dietary recommendations that are not calorie restriction, but there's definitely different things that you can do. The research community has many different opinions about which is the best one. There is not one best one, right? The best one is the one that you want to stick with. Sarah, did you ever land on a diet that worked for you, or like an eating plan that you thought was helpful? I know there's so many out there, and it's kind of is like, which, religion are you going to worship, sort of?
Right. Just sort of like an anti-inflammatory diet is sort of, I was familiar with just being
where you landed.
Yes, and it was just like a really like healthy option to begin with, just across the board. So that's kind of what I follow. A lot of that includes a lot of like Mediterranean food, which I grew up eating. So I was already relatively familiar with a lot of those ingredients and dishes. So that's something that I have felt has been helpful, and I really feel my best when I'm eating some more just anti-inflammatory things. And I'm really intentional about not being overly restrictive and just having a real healthy balance and thinking about like, okay, how does this make me feel versus being really rigid with it? Because personally, I have had a history of being like rigid with my, super structured with my diet. And that's something that I think I don't necessarily function my best at versus just listening to my body and being a little more intuitive about it. I think that's just super important at the end of the day, is figuring out how does it actually make you feel?
Yeah. And I think that one of the reasons why we built this lipedema support community is we try to put some definitions around all these different diets, right? And reasons why you'd want to do it, maybe side effects of doing a different diet. What does the research show of how it can be beneficial? And so really can be helpful to take some time to learn about these different diets and why they be recommended, and then pick one and sort of see how it goes. And, we try the 80-20 rule, right? Not maybe necessarily always being 100% on one nutritional plan, but for the most part, trying to weave that in your day-to-day and what you want to do in terms of eating. So the next kind of patient vignette we want to talk about is Sandy. So Sandy is a woman who maybe has lipedema, but her main complaint is swelling. So she's the woman who comes to see me because, she got pregnant and she was on bed rest because her legs were so swollen. The doctors thought her feet were going to explode. She can't work, a full day because she has so much swelling at the end of the day. She can't do anything she wants with her family because her legs are so heavy and feel like cement. I think treatment for Sandy at home is probably the most extensive. And we sort of group this in terms of lymphatic support. And lymphatic support can honestly be endless. Like you could do endless techniques throughout the day, and it can consume a lot of your time. I think it can be helpful to get started with a few things and see what works and see how much you need. So, of course, the small changes you can make are just starting with basic compression. There are some links in the Lipedema Support Community to some of our vetted compression companies that have lipedema specific compression that is not just, up to your mid calf, which is essentially pointless, but it can be tights all the way down from your toes upwards. There are even total body suits if you need like your arms covered and your legs. And a lot of women find that to be really helpful, particularly if they know they're, are looking into a lot of activity. There's also a lot of holistic stuff that's out there. So like dry brushing, vibration plates, all that stuff is in the social media world. And we had the explanation all in there to give women an idea of whether or not that would make sense for them. It's not, everything is not going to be the golden ticket for every woman. And so it can be helpful to try these different tools and see what works. One of my favorite aspects of our lipedema support community is we actually have a lipedema coach. Her name is Ginger. She's a woman who has lipedema herself. And she's going to be there to provide support, answer questions, right? You may say, hey, this is what I do with my vibration plate. Like, what do you think? And she can give her 2 cents. And, I can give my medical 2 cents. And we're there to all sort of learn from each other and have it be kind of a safe place that we can try different things and learn some of the, up-to-date research that's coming out in terms of being supportive. Mm-hmm. The last woman that I sort of see is Jennifer. Jennifer is a woman who maybe doesn't have a ton of swelling and maybe is an early stage, but she has a tremendous amount of pain. And so this is that woman that, doesn't like to be touched. Her sex life is affected. She can't sleep. She can't put her kids on her lap. And that pain really affects her day to day. Believe it or not, we sort of pull out different medications and dietary plans depending on what symptom sort of bothers you the most. And so you may be someone that's like, yes, I am Jennifer. That is me. And you'd want to spend a lot of time understanding the different medications and home treatment options that would make sense for someone such as Jennifer, and seeing if those can fit any of your needs. And then lastly, because we don't ever want to do something and not know if it's working, we have a lipedema tracking worksheet that you can use to sort of fill in the gaps and say, okay, I'm going to do this plan for the next week. Let's see how I'm feeling. And it's a way of sort of looking at both your symptoms and function to see if any of that makes sense. Because it can be hard when you're doing some of these things, because some of the improvements can be slow, right? Like you may say, oh, like I'm a little bit better. Is this working? I don't know. It's a lot of time, that I'm dedicating to this. Is it worth it? And this is just a way that women can download it and track their symptoms and sort of see how they're feeling. We are excited to keep improving upon this as time goes on and more patients ask questions. And really, this is patient driven. This is meant to be a resource for women out there that just want something, right? The beginning of a treatment plan. Mm-hmm. So we're really looking forward to women sharing their stories and utilizing that. I don't know, Sarah, do you think that would be something that would have been helpful, like to kind of get with the beginning of your journey?
Yeah, definitely. I think as you're sort of learning all the aspects of lipedema and all the components of your life that it can affect, it can be really overwhelming to say, okay, now where do I start? And like you said, how do I know if the things that I'm doing are working? That's a really nice way to like sort of compartmentalize it in a place where, okay, visually I can see and I can track, and it gives me a little structure so that way I can determine, yes, this is working for me. No, this I'm not really seeing much difference with, or, I'm not really feeling much difference with.
Yeah.
And it just sort of, it's a great tool for being able to propel yourself forward in one direction or another.
Yeah. I think, well, one, women say this to me all the time. I think, quote unquote, how do I get started? Right? Like, okay, I got it. I hear you. You know, I'm here. I have this diagnosis. Like, where's even the beginning? And I think that there's so much to sort of get started with that it can feel overwhelming. And we hope to slow it down and kind of give them a piece by piece section of things to talk about. The second thing is I think everyone with lipedema sort of has to make a decision about whether or not reduction surgery is something that they'd want to do. Reduction surgery is medical liposuction, where we are removing the fat tissue and then removing any excess skin, because obviously your skin does stretch as your fat cells expand and you have more swelling. So you may need also skin removal. And women have shown a decrease in progression, an improvement of pain, an improvement of swelling, and an improvement of function. So there's a lot of reasons why this may make sense. It is definitely not the answer for everybody, but it is an option that's out there. Sarah, do you mind sharing your story about surgery?
Yeah. So when I was investigating what can be done in terms of treatment for lipedema, and I came across surgery and sort of kind of reckoned with the fact that this tissue and this fat can only, be physically removed through surgical reduction. That was something that I knew I wanted to pursue. Just knowing, fearing for future mobility. And I feel lucky that I have the diagnosis at the age that I have it at. So I can sort of, it feels like it's an option where I can take control. One massive barrier, especially in the US, is getting our, insurance to cover this, because it's not generally looked at yet as medically necessary, which is really unfortunate. That was something that I also sort of was learning along the way as I was going, okay, this is the route I want to go. How do I make it happen now?
Yeah.
And it is possible to get it covered in the US. I just know from my conversation, it's hard work, unfortunately. I think a lot of women are having more success, though, than they have in the last couple of years.
I would argue that that's probably true. Yeah.
Yeah. So that's great to know that, like, we're headed in the right direction. But personally for me, for my surgery, I am traveling internationally to have that done, which seems kind of crazy when you think about it. But I'm traveling to Madrid, Spain, to a clinic called Lipedema. The head surgeon there is Dr. Burgos de la Abra. And that was, again, the power of social media, discovering them and their work and how hyper specialized they are, and actually having discussions with some of their actual patients as well. One, that was a huge confidence boost for me to go, okay, like, all of my concerns are sort of being addressed by having these conversations, not only with the surgeons at Lipedema, but also actual patients. But then also the financial aspect of that was something that was majorly attractive to me. Because in the US, it is much more expensive and difficult to get your insurance to cover. Although not impossible, I want to reiterate that it's not impossible. It's just very difficult. I just knew for myself that I didn't want to take that path. So I'm pursuing international because the expertise is there, and the cost for me is so much more realistic to do. It's something that, yes, I've had to take on a little side gigs here and there, but and I'm very fortunate to be in a position where I can have a family member travel with me over there when I'm going to be having that surgery. But it's such a personal, individual journey. And there are so many factors that go into deciding whether that is something that, one, is right for you, and two, is possible for you, because not every surgeon is the same. Not everybody's situation is the same. And it just takes a lot of research and just having some really candid conversations with some other people who have been there.
Mhm. Yeah, I think, and Jennifer had said reduction surgery is just so expensive, which it's true, right? It's upwards of 10 to 30 plus $1,000. And a lot of people cannot obviously swing that amount of money.
Mhm.
Most insurance plans now do have a clause that talks about lipedema. Again, not everyone, but a lot of them do. And it can be worth some of your time to look into your insurance plan clause to see what are the check boxes that they're going to be looking at. I will say the majority of the time they need a letter from a surgeon and a letter from someone such as myself, like a primary care, internal medicine, family medicine, obesity medicine specialist. And then a couple of other things like, proof that this is lipedema, that it's odd. Like in some ways we're saying that we know that like calorie restriction doesn't work, but then the insurance companies want us to document it. It's a weird, insurance companies are weird and they do weird things. But we just sort of need to collect all that information to say, okay, this is like what's been going on. In addition, they, want you to say, oh, like, this isn't lymphedema, like you've been wearing compression, right? And so you just want to make sure you're documenting all these things down to sort of collect that if it's even possible to get insurance coverage.
Mhm.
And I see from Irene that it's really hard for our Canadian friends that there is no insurance options at all, which is really frustrating because I know that is not to have any options is terrible. Even in the United States, there aren't a ton of surgeons. So Carolyn asked if there are any surgeons in West Michigan. There's none that I know of that specifically do only lipedema in comparison to some of the other specialists across the country. So there's a group in California that does this pretty extensively. There's a couple surgeons in Chicago, Texas, Atlanta, New Jersey. There's more popping up and sort of coming up. And there is a woman in the Detroit area who we've had some good success with, but none in the West Michigan area that specifically do lipedema. Now, of course, that doesn't mean that a surgeon couldn't. It just means that they're not one that we sort of see in the community on a regular basis. Yeah, and I know Irene sounds like it's been a real battle, and I feel you, Irene, of how tough it must be to not be able to have access to all your treatment options. So, and there is kind of a rundown of what you should think about in terms of reduction surgery at the Lipedema Support Community, just to answer some of those questions and even just get your mind thinking of like, if this is something I want to do, what are the questions I should be asking a surgeon? And what does this whole kind of journey look like? I would say it's not I'm going to backtrack. I'm always shocked that everyone kind of assumes plastic surgery is kind of like a easy afternoon thing and that you get to like turn around. It is not. It's not even for cosmetic plastic surgery. It's definitely not for reduction surgery. I mean, we are talking about a good chunk of time that will be dedicated to healing after it's done. And a lot of these surgeries are even done over a series of 2 to 3 to even 4 surgeries, depending on how advanced the stages of lipedema.
Mm-hmm.
So, Sarah, this is part of our True Facebook Live. We're going to move into our 5 take-home tips. And we're still here to answer questions if anyone has any questions. So, tip number 1, consider a diagnosis of lipedema. If Sarah's story has resonated with you and you're someone who's been on the fence about whether or not you have lipedema, take some time to find someone who may know about it. Even in the obesity medicine world, I think more and more doctors are learning about it and could provide you a diagnosis. It's okay to be wrong. Like maybe you have it and a doctor does a good clinical review and says, no, you're not. That's okay, right? That's okay. And so that's our second tip. Don't be afraid to be wrong. The other thing is don't be afraid to be wrong if you want to try, I don't know, dry brushing, right? Maybe it's not going to be as impactful for you. That's okay, right? It's, no harm, no foul. And, you may be out some money in terms of a brush, but give some of these different kind of quirky things a shot and it may be helpful. Number 3, take care of your lymphatic system. So one, this is true for a lot of women, and particularly as we age, but take some time to find compression that works for you and to find some time, like if you're someone who stands all day at work, like figure out a way to make that happen. Do you need a pneumatic compression pump, which is something that your insurance will cover in the United States if you have a good deal of lymphedema and we can get the documentation right. So figure out all the tools that you need and bring them into your, toolkit to really protect your lymphatic system to the best of your ability. This is true both before reduction surgery and after. So that is not something that stops. I will say it's significantly easier after reduction surgery, but it's still something that every woman should think about, particularly women with lipedema. Number 4, find some experts and seek out a second opinion. So if I've had a lot of women who have come to me who do have lipedema and saw a random doctor, and they were like, no, you don't have it. And if you're pretty convinced, get a second opinion, right? Again, don't be afraid to be wrong. And it may be that doctor just doesn't know. Living in the obesity medicine space, it's shocking how much weight bias is out there, right? Like still, even in doctors, even though we're supposed to be, fighting for our patients, like there's just some doctors that will just not accept these things and just will continue the mantra of eating less and moving more. So you may run into these people. If it does not fit what you believe clinically is going on, get a second opinion. Number 5, do not be afraid to try new things. I think one of the fun things about lipedema is there's a lot of research that's coming out, and there's new medicines that are going to be available. There are a lot of supplements that are out that sometimes can be impactful. Try some different things, track how your function symptoms change, and, sort of see what works for you. Michelle asks, is this a lifelong progressive condition that will always be present? Michelle, yes, unfortunately, this is something that is not curable. So even with reduction surgery, we're not taking away these cells completely, these disease fat cells completely, and we're not taking away all the fibrotic tissue that has been laid down over, years to decades of your life. Progression, most of the time this will progress with huge hormonal shifts. So that's puberty, pregnancy, menopause. We typically see after menopause that it will continue to sort of slowly tick by, but that's really where we see rapid weight progression. Reduction surgery tends to stall that progression, or it progresses much less aggressively, which is one reason why a lot of women such as Sarah do try to seek out these different options of finding a surgery plan that works for them. One of the things that I always give as a caveat to this, though, is that forever women with lipedema were battling this by themselves. Like they didn't have a lot of doctor support. There wasn't a ton of money in research, and we weren't doing much of anything. And so these women sort of suffered in silence, and their weight sort of progressed and their lymphatic system wasn't supported and things moved right along. We're in a different chapter now. We're doing a lot in terms of medications, in terms of supplements, in terms of dietary recommendations that are beyond just eating less. And I'm hoping that all that will limit some of the progression, even without reduction surgery. Like if we're really, such as Sarah, diagnosing a woman early and she's getting right on top of it, of, supporting her lymphatics and thinking about different dietary changes, like maybe this won't be as progressive. I think time will tell as sort of things go on. But thank you so much for that question. And Liz had a question. If a patient has varicose veins as well as lipedema, do the veins need to be treated prior to reduction surgery? Or did the lipedema likely cause the varicose veins? Liz, great question. So that is a hard question to answer because it really varies per vascular surgeon and plastic surgeon, or a surgeon who's performing reduction surgery. Every surgeon sort of has their own vibe as to what they want to do with something such as varicose veins. And it can be worth basically getting an opinion from a vascular surgeon who would treat the varicose veins before you want to do reduction surgery. Now, I want to just tell you, sometimes the vascular surgeons can lead you astray and say, oh my gosh, like just let me do these varicose veins and everything will be fine, right? This will get better, all the swelling will get better. I don't think that is, I haven't seen treating varicose veins being this like 100% a golden ticket out of all the symptoms that come with lipedema. But I definitely think it's worth a conversation with a vascular surgeon just to sort of collect all your information and, understanding what sort of makes sense. And then definitely if you're thinking about reduction surgery, asking that surgeon what they would prefer in terms of, seeing a vascular surgeon or any sort of vascular surgery treatments before or after surgery. And they kind of every surgeon sort of has a different opinion.
Mm-hmm.
Did the lipedema likely cause the varicose veins? All this is all your connective tissue and they all run together. So it's kind of a bit of a chicken or the egg situation. Let's just say that your connective tissue is not functioning like an average person, and it can just lead to things like varicose veins. Of course, the fibrotic tissue that gets laid down because of the diseased fat cells that come from lipedema sort of put pressure on the venous system, but in general, it's not the overall cause of the varicose veins, which felt like a very non-answer to your question. But thank you, Liz. Those are two really great questions. Okay.
I can add to that really quickly.
Please, yes.
So at least personally for where I am going for surgery, they do have you get a vein ultrasound to rule out any, they call it varicose veins of importance. So over a certain diameter, they would like for you to get those treated before surgery, just as like a safety thing. And that is another instance, just from my own personal experience, that I would say, if something doesn't feel right with your results, to get a second opinion. Because I went to a clinic, had very interesting ultrasound results there, and then went to a vascular surgeon and had vastly different results there that felt a little more reflective of what the reality probably is. So that's another situation where if you're trying to pursue surgery and you're sort of staring down this list of things that you need to do to make that a reality, still get a second opinion on all those little steps along the way, because you can sort of get lost in the bustle of wanting to just get it done, get it on the books. But just be really, really sure about the steps you're taking along the way to make that a reality, if that's the route you're going to go.
Yeah. I think forever there just has been no great direction for women with lipedema. And it kind of is all these people being like, oh, I definitely can do that. And I definitely can do this. And we hope that gets less and less. And I hope more that, doctors such as myself, that as an internal medicine doctor, we're sort of like the quarterbacks of a patient's journey. And we hope that we're like, all right, let's provide some guidance here as to what we should do sort of step by step. So I think that will get more prominent as more of the obesity medicine world definitely gets involved with lipedema. Krista had a question. Is lipedema genetic? I'm concerned about my 20 and 22-year-old daughters. Yes, there does seem to be a genetic component with lipedema, particularly on the maternal side. A lot of the times, if not every woman will develop lipedema during puberty, and it can come later in life. It's something just to sort of keep an eye on and have a quick, trigger to have them see a specialist if they start noticing sort of either swelling or pain or sort of rapid fat tissue expansion. And Irene also says she has 3 daughters, from their 20s to their early 30s. And she's pretty sure one of them has it, and maybe the oldest. Yeah. And I think that's pretty typical of what we see, that there is a lot of times family members that will have it. And a lot of times women will say, oh my gosh, I was compelled to get some help because I saw my mom or my grandmother really struggled with this. And I don't want to be like that. I want to take some proactive steps at preventing some of the sort of, extensive progression. And Carolyn says, that yes, she unfortunately, a lot of members in her family have it, and it can appear at different times. That is absolutely accurate. Sometimes women won't even notice until they're pregnant for the first time, or even the third or fourth time. And then all of a sudden they're like, what happened with this pregnancy, right? And then they have all this tissue at their arms and thighs. And it's very frustrating, as you know, because they were sort of doing their normal thing. And then here they, now they're on a new journey with lipedema. So these are all great questions. Thank you so much. So now we're going to talk about 5 questions to bring to your primary care doctor. So one of the things at True that we try to get out into the world is we realize not everyone can come visit us at True Women's Health in Grand Rapids, Michigan. So if you're a woman in the beginning stages of lipedema, here's some questions you should ask your primary care doctor. What is your experience in caring for women with weight issues? You want someone who has some empathy, that doesn't have weight bias, particularly if you have a doctor who sort of throws in their own personal experience, like, well, you know what? Like, I ran a marathon and I lost weight, so there we go, right? That's someone you maybe would want to avoid kind of helping with these next steps because they're just not informed. And you want to, if someone has weight bias, just let's move in a different direction before it's really impactful. So, never be afraid to ask sort of their opinion about what their experience is with caring for these, caring for a woman such as yourself, because you need some expertise. 2, what is my phase of ovarian function? So a big mantra that we have at True Women's Health is we hope that every woman will know what their phase of ovarian function is. Are they in puberty? Are they in reproductive phase? Are they in perimenopause, menopause? Why that is so impactful is because we see symptoms, even in every woman, change as we move through these different phases of ovarian function. And it's important, particularly for lipedema, to know where you're at, because a lot of the times we will see rapid progression of lipedema fat at perimenopause and menopause. So it can be really helpful to know where you are at that journey. And it's not always as easy. And you can always check out our website at truewomenshealth.com. We have something called the Menopause Transition Scale that can provide you some insight into where you're at in terms of your perimenopause and menopausal symptoms. Number 3, what are my local resources for lymphatic support? So people to pull in locally, there are specialized lymphatic physical therapists that will do something called manual lymph drainage. And it's sort of like a type of massage or basically literally with their hands, they're moving some of that fluid in and out of your tissues. And that should be someone who's a specialist. A lot of the times those people will also have someone maybe in their clinic or office that can do specialized compression fitting. Like if you're someone who has a lot of extra adipose tissue at your calves and legs and buying compression off of Amazon totally does not make sense for you, that may be something that you want to look into. It can be also helpful to find local resources with people who work with mindful eating and intuitive eating, just kind of gaining some insight into learning how to stay on a healthy eating plan. A lot of us know what to eat in terms of what's eating healthy. A lot of us can sort of pull it together at the end of the day, but boy, are those cravings intense, right? Cravings for Oreos and chips and ice cream, and they're just so hard to battle. And so you may know what to eat, but your body and brain are just not cooperating. And it can be helpful to reach out to those local people to gain some support in terms of, like I said, mindful eating and what to do with those cravings that aren't just medications. Number 4, before we answer Christine's question, what is your experience using menopausal hormonal therapy? So menopausal hormonal therapy is giving your body back the sex hormones that your ovaries give you, which is estrogen, progesterone, and testosterone. As you go through perimenopause and menopause, those medications can be helpful in terms of minimizing your perimenopause and menopause symptoms. But for women with lipedema, we're really intrigued to see what the impact of menopausal hormonal therapy will be on the expansion of lipedema fat. Now, it's a bit confusing because in some regards, what we're saying is you have a ton of estrogen during puberty or a pregnancy, and then you gain all this fat, and now you're entering menopause, which is no estrogen, and now you want to give me estrogen. And a lot of it has to do with the ratios of the estrogen, progesterone, and the ratios of the different receptors at the cells on the lipedema fat themselves. And taking these different hormones can sometimes change what receptors are getting activated. So a lot of technical words there to say that I do not think that menopausal hormonal therapy will drastically worsen lipedema fat. A lot of it depends on how it's given. So there's different types. There's synthetic versus what we call bioidentical. That truly matters. All this is a summary of you need a doctor who knows what they're talking about with menopausal hormonal therapy to be helpful. So, ask those questions and make sure they're in the loop about menopausal hormonal therapy. We know that in the United States, there's the Menopause Society that you can find a certified menopause provider. And I know that there's a Canadian Menopause Society as well, that you should be able to find a doctor who knows some stuff about the menopausal hormonal therapy that's available in Canada. Number 5, what is your experiencing using the newer anti-obesity medications? So I feel like maybe we're on a different planet if you don't know about the injectables like Ozempic or Wegovy or Mounjaro, Zepbound. For the first time, those do seem to be impactful for women with lipedema. The research is ongoing right now in terms of all these researchers are collecting information about whether or not we can actually prove that in good clinical studies so that we can get insurance coverage. A lot of the times women with lipedema do already meet, if their insurance covers anything to do with weight, they do meet criteria based off of BMI, and that seems to be enough to get them coverage if their insurance plan covers it. There's also a lot of cash options in the United States that definitely don't make it free, but are way lower than like the thousands a month that were initially like several years ago with where they're at. So there are some good options, and it's at least worth a review of whether or not that makes sense. Again, you don't want a doctor that's like, oh, those anti-obesity medicines are all dumb and the side effects are too much. That's not the case. You need someone who is familiar with using them, knows how to deal with the side effects, knows how to do different dosing for different situations, and has a pretty good experience with the kind of aftermath of getting started with them. All that information is available in the Lipedema Support Community. If you're looking for, again, just more information of how to get started, you just want to be part of a group that maybe it's a little bit more medically driven versus just a patient support group, which we love those patient support groups, but this is just a little bit of a different vibe. And as always, Ginger will be there to answer questions about her journey and then be able to find answers for you. So we're really looking forward to seeing all of our ladies there. Sarah, thank you again for coming on.
Yeah, of course.
Yes.
If anybody wants to ask me any more questions, I'm on Instagram, sort of documenting my personal lipedema journey. And oh, yep, there it is. At Sarah_lipedema. Feel free to DM me if you have any more questions that I can give just on my own personal experience so far. My first surgery is in 2 months from tomorrow. So that's really exciting. I'm just really happy to be an open book. And if you just have questions or if you just want to commiserate a little, feel free to just shoot me a message.
Sarah, that is so awesome. And maybe we can connect like next year after your surgery journey, and we can hear a little bit of like what you thought, like, was it worth it? What would you have done differently? What did you love? Like all those different things.
Yeah, absolutely. I've got 1 surgery in September, 2nd surgery in January of next year, and a 3rd one in March. And yeah, we'll go from there. I don't know if there needs to be more after that, but I'm really looking forward to hopefully sharing how much of a difference that will have made on my life at that point.
Yeah, awesome. And thank you to all the women who are asking questions. These are great questions. I feel your frustration. I know this journey can be lonely, but we are here at True Women's Health to at least provide some support, even if it's just, like I said, in the virtual world of the True Women's Health Lipedema Support Community. Thank you so much for joining us.
Yes, thank you.